Uh, I'm very happy to be today here together with you. There are some persons that have been to Slovenia, so I know that many of you know a lot about our case. I will try to be quick and precise. So I don't have more than 15 minutes, so I'm not going to go very detailed, but if there is a need, I'm always here. I can answer questions, I can give some advice and so on. So I think everybody knows that this is the most famous picture of Slovenia. This is Lake Bled. Some facts, but very briefly. Yesterday when we spoke, we said we are almost like Kosovo in population and so on. I'm so proud because 20 years ago we said we are 1.98 million, now we are 2.1. So this is some rise. But at the end, Kosovo is very young population. Slovenia is very old population. I think in the next 15 years, in estimation, we are going to be one of the oldest population in entire Europe. So we have Bismarck model as Germany, Austria. You will see some changes. I will go briefly through some topics. So primary healthcare. Why primary healthcare? Because although we have been the same country with Kosovo 30 years ago, Slovenia kept very strong primary health care. So, and we are really proud about that. I will speak about preventive healthcare programs. The latest update are health promotion centers. I tackled this about target populations in need. And at the end, I will speak some words about are we successful or not. Briefly, healthcare system in Slovenia, we have universal coverage, based solidarity, fairness, and so on. Financing, compulsory and voluntary complementary health insurance till the end of this year. This year we passed the law and the complementary health insurance is not going to be in place anymore. The same is with the coverage because until the end of this year, entire population is going to be only on the compulsory health insurance. So all starts in primary health care. So we have a geographically well-distributed network. We have still community-level health centers, around 60 in entire Slovenia. They are owned by municipalities. Comparison is 76 physicians, percentage and 42% dentists. And of course we have some private-based concessionaires. These are GPs, pediatricians or gynecologists who are working private, but with the concession, with the contract with the health insurance. And the network is the matter of consensus between municipalities and Ministry of the Health. These are the services in the primary health care. We, as I said, we kept almost everything what it was before. So we still have gynecologists at the primary level, we still have pediatricians at the primary level, and each person in Slovenia can choose their own doctor according to the age. And of course, there is a basis for preventive care also there. So this is just to see how primary health care in Slovenia is. And the new circle you see is health promotion center. This is the added value and the in development. So we have strong gatekeeping. I know here in Kosovo you don't have this. Gatekeeping is not only for family doctors, also for pediatrician and also for gynecologists. There are no out-of-pocket payments, no waiting times, although I have to confess here that after COVID time we have some problems in accessing also primary healthcare because the needs are bigger than it were before. Okay, preventive program. This is a picture of near my hometown, Maribor. This is vineyard region, so it's heart-shaped, so I like this one. So how prevention programs actually evolved in Slovenia. We started in '98, actually with CINDI program. I don't know how many family doctors are here in the room, but it was a trend in that time about cholesterol, about hypertension. So it started there with family doctors working on these issues. Then we started with first national program on primary prevention. In 2011, there is another upgrade in family medicine. We call it model practices. I will speak in a workshop next week more about these model practices. Why this is important? It's important because the needs and reason came from the family doctors. They wanted to perform more preventive work to their chosen population, and this means they received half of the registered nurse in their team. Now from the next year, they will have one registered nurse altogether in their team. So one registered nurse, one doctor, and also administrative work. This is also very important because model practices mean they have quality indicators, they actually run over their population, they publish each year how they are working, how are the results of their population, they can compare in between. So this is a nice example. Then we have this Together for Health, Norwegian funded mechanism in 2013, upgrading the health promotion. And today, as I said, we have health promotion centers, which are built on all those initiatives. So you can see the two pillars. What are the prevention promotion services in primary healthcare? So in family medicine, you can see checkups, short counseling on lifestyle. In child and adolescent healthcare, also preventive checkups, short counseling, health promotion in schools. In reproductive, also all the preventive checkups, counseling. We have also preventive care in dentistry, which is actually very important for children in pediatrics part. And we have community nursing. I learned that also community nursing is very strong here in Kosovo, which makes me proud, because I think this is also one of the major contributor towards good health. So health promotion center means advanced basic lifestyle interventions on all the risk factors, high blood pressure, hyperlipidemia, high blood glucose, nutrition, physical activities, mental health, weight loss, smoking and alcohol drinking cessation. I'm not going deep into the alcohol and tobacco, but I heard a previous speaker, so I think you have to build, especially on the tobacco laws, really strong, because this is very good results at the end. Okay, this is just to sum up how the National Program for Integrated Prevention is for adults and for the children. These are basic interventions, and the main part is the multidisciplinary team, which is comprised by a registered nurse, physiotherapist, psychologist, dietitian, kinesiologist. This is one of the recent specialists in the healthcare, and physicians, of course, family medicine and pediatrician. This is how this looks in the local community. This is especially important because of the vulnerable groups. And I think that the strengthening of the public health role in primary healthcare centers is really important. Because it's dealing always, I removed one slide to show you that even in Slovenia, who is very small, there is a difference in how people in West and South are actually ill. So what are the problems there? So you have to really to tackle problems in the local communities and to adapt to the needs of the population. These are data from 2022. What was really done in the health promotion centers. So about 52,000 participants are in these activities. So you can see healthy lifestyles, healthy diet, physical activities, mental health is also very important. Recent years, adult obesity is also very problematic. And in Slovenia especially, not tobacco, but risky alcohol drinking is a huge problem. So in this case we are diverse, I would say. Type 2 diabetes, and also in pediatrics, we started with the children obesity management, because in recent years, also COVID time, not a lot of, I have to, okay, I will go. So you can see health promotion centers. So these are partnerships in total for the action groups. Important slide for me, who are these groups to whom we should act, how to approach them, and what are the programs which are really focused to them. Okay, I will give the slides to you and you can share. There were some barriers in this process, because in start there were, of course, skepticism if this is going to work or not. Second large problem is actually transfer of competences from doctor to nurse. But now, after years, it's not clear yet, but it's going better and better each year. What are the enablers? Strong political commitment, all stakeholders on board, and financing scheme. And the results in 20 years, you can see that more than a half of adult population was screened. More than 50,000 patients annually attend, and there are trends in the declining mortality for these diseases. Okay, I will go quickly through this. These are adopted strategic documents. My previous speaker was speaking. It's very important to have them, and okay, this is not. I will just speak about this because this is national screening programs, and we are really proud. I think we are the only country in Europe who has really national wide screening program for 3 cancers. So breast, cervical, and colon and rectal cancer. Okay, are we successful? We prolonged life expectancy. In this slide is no post-COVID little decline. We have good results with the infant mortality rate. I think we are one of the first or the second in Europe. We significantly reduced the mortality rate for cardiovascular disease, but there is a rise in cancer. I have to admit it. So, yeah, we have some problems. I told you, cancer, alcohol, obesity, mental health. So these are the facts. This is actually my last slide. We heard €1 or $1.07, but really if you see how little of all the finances is going to the health promotion in Slovenia, every euro is good invested. So we need to start at birth, also before birth. We have to have continuum through entire lifetime. We have to prevent, detect, diagnose and treat early, must be easy reachable, available, accessible, and on long term we are just on pluses. There are no minuses in this. Okay, this is me. Thank you.